Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Pseudoephedrine. Pseudoephedrine is an stereoisomer of ephedrine. Pseudoephedrine causes vasoconstriction, especially in the mucosa and in the skin. This pseudoephedrine has a fewer CNS side effects and cardiac effects are less for pseudoephedrine. The pseudoephedrine is a poor bronchodilator and it is used orally as a decongestant. Especially, it is used orally as a decongestant in upper respiratory tract, nose, and it is used as a decongestant in eustachian tubes.
thank you and thank you for watching.